RN Prometric Exam Collection 161 to 180. Part 9. 161. A nurse prepares a teaching plan for a mother of a child diagnosed with bacterial conjunctivitis. Which of the following, if stated by the mother, indicates a need for further teaching? 1. I need to wash my hands frequently. 2. I need to clean the eye as prescribed. 3. It is okay to share towels and washcloths. 4. I need to give the eye drops as prescribed. The answer is 3. It is okay to share towels and washcloths. Rationale: conjunctivitis is an inflammation of the conjunctiva. Bacterial conjunctivitis is highly contagious, and the nurse should teach infection control measures. These include good hand washing and not sharing towels and washcloths. Options 1, 2, and 4 are correct. Treatment measures. 162. Antibiotics are prescribed for a child with otitis media who underwent a myringotomy with insertion of tympanostomy tubes. The nurse provides discharge instructions to the parents regarding the administration of the antibiotics. Which statement, if made by the parents, indicates that they understood the instructions? 1. Administer the antibiotics until they are gone. 2. Administer the antibiotics if the child has a fever. 3. Administer the antibiotics until the child feels better. 4. Begin to taper the antibiotics after 3 days of a full course. The answer is 1. Administer the antibiotics until they are gone. Rationale: a myringotomy is the insertion of tympanoplasty tubes into the middle ear to promote drainage of purulent middle ear fluid and to equalize pressure and keep the ear aerated. The nurse must instruct parents regarding the administration of antibiotics. Antibiotics need to be taken as prescribed, and the full course needs to be completed. Options 2, 3, and 4 are incorrect. Antibiotics are not tapered, but are administered for the full course of therapy. 163. A 10-year-old child with asthma is treated for acute exacerbation in the emergency department. A nurse caring for the child monitors for which of the following, knowing that it indicates a worsening of the condition? 1. Warm, dry skin. 2. Decreased wheezing. 3. Pulse rate of 90 beats/min. 4. Respirations of 18 breaths/min. The answer is 2. Decreased wheezing. Rationale: asthma is a chronic inflammatory disease of the airways. Decreased wheezing in a child with asthma may be interpreted incorrectly as a positive sign when it may actually signal an inability to move air. A silent chest is an ominous sign during an asthma episode. With treatment, increased wheezing actually may signal that the child's condition is improving. Warm, dry skin indicates an improvement in the child's condition because the child is normally diaphoretic during exacerbation. The normal pulse rate in a 10-year-old is 70 to 110 beats/min. The normal respiratory rate in a 10-year-old is 16 to 20 breaths/min. 164. The mother of an 8-year-old child being treated for right lower lobe pneumonia at home calls the clinic nurse. The mother tells the nurse that the child complains of discomfort on the right side and that the ibuprofen, Motrin, is not effective. The nurse should tell the mother to 1. Increase the dose of the ibuprofen. 2. Increase the frequency of the ibuprofen. 3. Encourage the child to lie on the left side. 4. Encourage the child to lie on the right side. The answer is 4. Encourage the child to lie on the right side. Rationale: pneumonia is an inflammation of the pulmonary parenchyma or alveoli or both caused by a virus, mycoplasmal agents, bacteria, or aspiration of foreign substances. Splinting of the affected side by lying on that side may decrease discomfort. It would be inappropriate to advise the mother to increase the dose or frequency of the ibuprofen. lying on the left side would not be helpful in alleviating discomfort. 165. A clinic nurse is providing instructions to a mother of a child with cystic fibrosis regarding the immunization schedule for the child. Which statement would the nurse make to the mother? 1. The immunization schedule will need to be altered. 2. The child should not receive any hepatitis vaccines. 3. The child will receive all the immunizations except for the polio series. 4. The child will receive the recommended basic series of immunizations along with a yearly influenza vaccination. The answer is 4. The child will receive the recommended basic series of immunizations along with a yearly influenza vaccination. Rationale: cystic fibrosis is a chronic multisystem disorder, autosomal recessive trait disorder, characterized by exocrine gland dysfunction. The mucus produced by the exocrine glands is abnormally thick, tenacious, and copious, causing obstruction of the small passageways of the affected organs, particularly in the respiratory, gastrointestinal, and reproductive systems. Adequately protecting children with cystic fibrosis from communicable diseases by immunization is essential. In addition to the basic series of immunizations, a yearly influenza immunization is recommended for children with cystic fibrosis. Options 1, 2, and 3 are incorrect. 166. An emergency department nurse is caring for a child diagnosed with epiglottitis. Assessing the child, the nurse monitors for which indication that the child may be experiencing airway obstruction. 1. The child exhibits nasal flaring and bradycardia. 2. The child is leaning forward, with the chin thrust out. 3. The child has a low-grade fever and complains of a sore throat. 4. The child is leaning backward, supporting himself or herself with the hands and arms. The answer is 2. The child is leaning forward, with the chin thrust out. Rationale: epiglottitis is a bacterial form of croup. A primary concern is that it can progress to acute respiratory distress. Clinical manifestations suggestive of airway obstruction include tripod positioning, leaning forward while supported by arms, chin thrust out. Mouth open, nasal flaring, the use of accessory muscles for breathing. And the presence of stridor. Option 4 is an incorrect position. Options 1 and 3 are incorrect because epiglottitis causes a high fever and tachycardia. 167. A child with laryngotracheobronchitis, croup, is placed in a cool mist tent. The mother becomes concerned because the child is frightened, consistently crying and trying to climb out of the tent. The appropriate nursing action is to 1. Tell the mother that the child must stay in the tent. 2. Call the physician and obtain a prescription for a mild sedative. 3. Place a toy in the tent to make the child feel more comfortable. 4. Let the mother hold the child and direct the cool mist over the child's face. The answer is 4. Let the mother hold the child and direct the cool mist over the child's face. Rationale: laryngotracheobronchitis, croup, is the inflammation of the larynx, trachea, and bronchi and is the most common type of croup. Cool mist therapy may be prescribed to liquefy secretions and to assist in breathing. If the use of a tent or hood is causing distress, treatment may be more effective if the child is held by the parent and a cool mist is directed toward the child's face. A mild sedative would not be administered to the child. Crying would increase hypoxia and aggravate laryngospasm, which may cause airway obstruction. Options 1 and 3 would not alleviate the child's fear. 168. A nurse is caring for an infant with bronchiolitis, and diagnostic tests have confirmed respiratory syncytial virus, RSV. Based on this finding, which of the following is the appropriate nursing action? 1. Initiate strict enteric precautions. 2. Move the infant to a room with another child with RSV. 3. Leave the infant in the present room because RSV is not contagious. 4. Inform the staff that they must wear a mask, gloves, and a gown when caring for the child. The answer is 2. Move the infant to a room with another child with RSV. Rationale: respiratory syncytial virus, RSV, is a highly communicable disorder and is not transmitted via the airborne route. The virus usually is transferred by the hands. Use of contact and standard precautions during care is necessary. Using good hand-washing techniques and wearing gloves and gowns are also necessary. Masks are not required. An infant with RSV is isolated in a single room or placed in a room with another child with RSV. Enteric precautions are unnecessary. 169. A clinic nurse reads the results of a Mantoux test on a 3-year-old child. The results indicate an area of induration measuring 10 mm. The nurse would interpret these results as 1. Positive. 2. Negative. 3. Inconclusive. 4. Definitive and requiring a repeat test. The answer is 1. Positive. Rationale: induration measuring 10 mm or more is considered to be a positive result in children younger than 4 years of age and in children with chronic illness or at high risk for exposure to tuberculosis. A reaction of 5 mm or more is considered to be a positive result for the highest risk groups, such as a child with an immunosuppressive condition or a child with human immunodeficiency virus, HIV, infection. A reaction of 15 mm or more is positive in children 4 years or older without any risk factors. 170. The mother of a hospitalized 2-year-old child with viral laryngotracheobronchitis, croup, asks a nurse why the physician did not prescribe antibiotics. The appropriate response is 1. The child may be allergic to antibiotics. 2. The child is too young to receive antibiotics. 3. Antibiotics are not indicated unless a bacterial infection is present. 4. The child still has the maternal antibodies from birth and does not need antibiotics. The answer is 3. Antibiotics are not indicated unless a bacterial infection is present. Rationale: laryngotracheobronchitis, croup, is the inflammation of the larynx, trachea, and bronchi and is the most common type of croup. It can be viral or bacterial. Antibiotics are not indicated in the treatment of croup unless a bacterial infection is present. Options 1, 2, and 4 are incorrect. In addition, no supporting data in the question indicate that the child may be allergic to antibiotics. 171. A nurse caring for an infant with congenital heart disease is monitoring the infant closely for signs of congestive heart failure, CHF. The nurse assesses the infant for which early sign of CHF? 1. Pallor. 2. Cough. 3. Tachycardia. 4. Slow and shallow breathing. The answer is 3. Tachycardia. Rationale: congestive heart failure, CHF, is the inability of the heart to pump a sufficient amount of oxygen to meet the metabolic needs of the body. The early signs of CHF include tachycardia, tachypnea, profuse scalp sweating, fatigue and irritability, sudden weight gain, and respiratory distress. A cough may occur in CHF as a result of mucosal swelling and irritation, but is not an early sign. Pallor may be noted in an infant with CHF, but is not an early sign. 172. A nurse is caring for a child with a suspected diagnosis of rheumatic fever. The nurse reviews the laboratory results, knowing that which laboratory study would assist in confirming the diagnosis? 1. Immunoglobulin. 2. Red blood cell count. 3. White blood cell count. 4. Antistreptolysin O titer. The answer is 4. Antistrep tollicin O titer. Rationale: rheumatic fever is an inflammatory autoimmune disease that affects the connective tissues of the heart, joints, subcutaneous tissues, and blood vessels of the central nervous system. A diagnosis of rheumatic fever is confirmed by the presence of two major manifestations or one major and two minor manifestations from the Jones criteria. In addition, evidence of a recent streptococcal infection is confirmed by a positive antistrep tollicin O titer streptozyme assay or anti-DNase B assay. Options 1, 2, and 3 would not help to confirm the diagnosis of rheumatic fever. 173. A nurse is preparing for the admission of a child with a diagnosis of acute stage Kawasaki disease. On assessment of the child, the nurse expects to note which clinical manifestation of the acute stage of the disease. 1. Cracked lips. 2. Normal appearance. 3. Conjunctival hyperemia. 4. Desquamation of the skin. The answer is 3. Conjunctival hyperemia. Rationale: Kawasaki disease is also known as mucocutaneous lymph node syndrome and is an acute systemic inflammatory illness. In the acute stage, the child has a fever, conjunctival hyperemia, red throat, swollen hands, rash, and enlargement of the cervical lymph nodes. In the subacute stage, cracking lips and fissures, desquamation of the skin on the tips of the fingers and toes, joint pain, cardiac manifestations, and thrombocytosis occur. In the convalescent stage, the child appears normal, but signs of inflammation may be present. 174. A nurse provides home care instructions to the parents of a child with congestive heart failure regarding the procedure for administration of digoxin, Lanoxin. Which statement made by the parent indicates the need for further instructions? 1. I will not mix the medication with food. 2. If more than one dose is missed, I will call the physician. 3. I will take the child's pulse before administering the medication. 4. If the child vomits after medication administration, I will repeat the dose. The answer is 4. If the child vomits after medication administration, I will repeat the dose. Rationale: digoxin is a cardiac glycoside. The parents need to be instructed that if the child vomits after digoxin is administered, they are not to repeat the dose. Options 1, 2, and 3 are accurate instructions regarding the administration of this medication. In addition, the parent should be instructed that if a dose is missed and is not identified until 4 hours later, the dose should not be administered. 175. An infant with congestive heart failure is receiving diuretic therapy, and a nurse is closely monitoring the intake and output. The nurse uses which most appropriate method to assess the urine output? 1. Weighing the diapers. 2. Inserting a Foley catheter. 3. Comparing intake with output. 4. Measuring the amount of water added to formula. The answer is 1. Weighing the diapers. Rationale: congestive heart failure is the inability of the heart to pump a sufficient amount of oxygen to meet the metabolic needs of the body. The most appropriate method for assessing urine output in an infant receiving diuretic therapy is to weigh the diapers. Comparing intake with output would not provide an accurate measure of urine output. Measuring the amount of water added to formula is unrelated to the amount of output. Although Foley catheter drainage is most accurate in determining output, it is not the most appropriate method in an infant and places the infant at risk for infection. 176. A clinic nurse reviews the record of a child just seen by a physician and diagnosed with suspected aortic stenosis. The nurse expects to note documentation of which clinical manifestation specifically found in this disorder. 1. Pallor. 2. Hyperactivity. 3. Exercise intolerance. 4. Gastrointestinal disturbances. The answer is 3. Exercise intolerance. Rationale: aortic stenosis is a narrowing or stricture of the aortic valve, causing resistance to blood flow in the left ventricle, decreased cardiac output, left ventricular hypertrophy, and pulmonary vascular congestion. A child with aortic stenosis shows signs of exercise intolerance, chest pain, and dizziness when standing for long periods. Pallor may be noted, but is not specific to this type of disorder alone. Options 2 and 4 are not related to this disorder. 177. A nurse has provided home care instructions to the mother of a child who is being discharged after cardiac surgery. Which statement made by the mother indicates a need for further instructions? 1. A balance of rest and exercise is important. 2. I can apply lotion or powder to the incision if it is itchy. 3. Activities in which my child could fall need to be avoided for 2 to 4 weeks. 4. Large crowds of people need to be avoided for at least 2 weeks after surgery. The answer is 2. I can apply lotion or powder to the incision if it is itchy. Rationale: the mother should be instructed that lotions and powders should not be applied to the incision site after cardiac surgery. Lotions and powders can irritate the surrounding skin, which could lead to skin breakdown and subsequent infection of the incision site. Options 1, 3, and 4 are accurate instructions regarding home care after cardiac surgery. 178. A nurse is preparing to care for a child with a diagnosis of intussusception. The nurse reviews the child's record and expects to note which symptom of this disorder documented. 1. Watery diarrhea. 2. Ribbon-like stools. 3. Profuse projectile vomiting. 4. Bright red blood and mucus in the stools. The answer is 4. Bright red blood and mucus in the stools. Rationale: intussusception is a telescoping of one portion of the bowel into another. The condition results in an obstruction to the passage of intestinal contents. A child with intussusception typically has severe abdominal pain that is crampy and intermittent, causing the child to draw in the knees to the chest. Vomiting may be present, but is not projectile. Bright red blood and mucus are passed through the rectum and commonly are described as currant jelly-like stools. Watery diarrhea and ribbon-like stools are not manifestations of this disorder. 179. A clinic nurse reviews the record of an infant and notes that the physician has documented a diagnosis of suspected Hirschsprung's disease. The nurse reviews the assessment findings documented in the record, knowing that which symptom most likely led the mother to seek health care for the infant. 1. Diarrhea. 2. Projectile vomiting. 3. Regurgitation of feedings. 4. Foul-smelling ribbon-like stools. The answer is 4. Foul-smelling ribbon-like stools. Rationale: Hirschsprung's disease is a congenital anomaly also known as congenital aganglionosis or a ganglionic megacolon. It occurs as the result of an absence of ganglion cells in the rectum and other areas of the affected intestine. Chronic constipation beginning in the first month of life and resulting in pellet-like or ribbon-like stools that are foul-smelling is a clinical manifestation of this disorder. Delayed passage or absence of meconium stool in the neonatal period is also a sign. Bowel obstruction, especially in the neonatal period, abdominal pain and distension, and failure to thrive are also clinical manifestations. Options 1, 2, and 3 are not associated specifically with this disorder. 180. A nurse reviews the record of a newborn infant and notes that a diagnosis of esophageal atresia with tracheoesophageal fistula is suspected. The nurse expects to note which most likely sign of this condition documented in the record. 1. Incessant crying. 2. Coughing at night time. 3. Choking with feedings. 4. Severe projectile vomiting. The answer is 3. Choking with feedings. Rationale: in esophageal atresia and tracheoesophageal fistula, the Esophagus terminates before it reaches the stomach, ending in a blind pouch, and a fistula is present that forms an unnatural connection with the trachea. Any child who exhibits the 3 Cs, coughing and choking with feedings and unexplained cyanosis, should be suspected to have tracheoesophageal fistula. Options 1, 2, and 4 are not specifically associated with tracheoesophageal fistula.